everyone, this is Edv from second year MBBS, and today we're going to be doing a video on cardiac cycle. So everything you need to know about cardiac cycle is literally encapsulated in this graph. I got it from Kaplan Physiology. And I know it looks a bit daunting at first, but trust me, once I break it down, it's going to be a little easier. So before I do get into this graph, I do want to touch up on a few concepts. So the heart valves, they work based on pressure difference. So due to a difference of pressure, only then they'd move, right? So for example, if the right ventricular pressure is greater than right atrial pressure, then the tricuspid valve moves towards the side where there is less pressure. So atrial pressure come hai, the valves will go a little backward, the flaps, so the valves close. However, vice versa, if the atrial pressure is greater than ventricular pressure, so the valves open. इसी तरह वो blood flow होता है. And another thing I want to talk about is the heart does two things in systole. It pressurizes and dejects, ठीक है? मतलब पहले pressure बनता है, फिर वो release करता है blood को, and in diastole it depressurizes and refills. मतलब pressure कम होता है, फिर refilling होती है. Without further ado, let's get into this graph. Now, अभी इस पे ना focus करो. Focus on the panels I mentioned. Not me, but yeah. 1, 2, 3, 4. I'm gonna break the phases down into these parts anyway. So if you look at the first phase, you look at this ventricular pressure graph, ठीक है, जो non-dotted blue line है, ये left ventricular pressure है, and as you can see, oh, ये atrial pressure dotted है. So prior to this, it's a little constant, but when it exceeds when ventricular pressure exceeds atrial pressure, the mitral valve closes. And mitral valve is the valve which is the atrioventricular valve, नहीं होता? It's that valve. So when it exceeds, the valve closes. So as it's exceeding up to this point. But notice this, the volume, the ventricular volume, let me just mark stuff. Notice this, ventricular volume, this remains constant even though pressure increase हो रहा है. This is because both of these valves are closed. Aortic valve जो सामने वाला valve है वो closed है, पीछे वाला valve, mitral valve is closed. So right now this is known as isovolumetric contraction. This is known as isovolumetric contraction, which means isovolumetric means no change in volume and it's contracting. So pressure बढ़ रहा है but there's no change in volume. Now, when the pressure reaches up to the point of the aortic pressure, the ventricular pressure, the aortic valve opens, ठीक है? And then the pressure further increases. Now look at the graph. Of 1 के phase के बाद जो 2 का start है, 2 panel 2 का start है, यहाँ पे नीचे देखो, जो volume है starts decreasing, ठीक है? Up until the end of the panel 2, volume decrease हो जाती है full, and if you notice the graph, the pressure is increasing, but then it starts to decrease. The second phase is known as the ejection phase. यहाँ पे क्योंकि सारा pressure build up होता है in the ventricle and then it shoots all the blood out into the aorta or pulmonary artery depending on which side of the heart you're looking at. So this phase is known as the ejection phase. पहले pressurize होता है, वो pressure build होता है and then it ejects with force, ठीक है? That's how the whole mechanism works, and you notice this ventricular volume decrease हो गई and reaches up till a certain point. Now, when the pressure starts to decrease in the ventricles, now we start the third phase, which is known as isovolumetric relaxation. Now the ventricular pressure is decreasing and it further decreases. Our pressure has now, the ventricular pressure is lower than aortic pressure. The valve now closes. The aortic valve बंद हो जाता है, मतलब क्योंकि कोई pressure से कोई चीज़ आ ही नहीं रही, तो it has to close the valve to prevent the backflow. जो जितना blood pump हुआ है वो वापस ना आ जाए. That's why the valve closes. Now, the pressure then further decreases up until mitral valve wala point. उस पे उधर भी decrease होता है, but I'm trying to make a point here. So now we start the panel 4. Now panel 4 is known as filling phase. Can you guess why? The ventricular volume starts to rise, and this is known as the filling phase, क्योंकि इस point पे ventricular volume increase हो रही है क्योंकि आपका pressure low है और फिर आपका mitral valve opens. Yeah. So when the ventricular pressure is lower than that of the atrial pressure, mitral valve opens क्योंकि atrial pressure ज़्यादा है than ventricular pressure. Like I just mentioned the concept at the start of the video. It starts, तो फिर pressure further decrease होता है, फिर वो filling हो रही होती है यहाँ पे, फिर यहाँ से up हो रहा होता है, all that. So yeah, that's what encapsulates the cardiac cycle. As you can see, यहाँ पे वापस normalize हो जाता है. This is the maximum amount, and this is what you see here. So जो ये चीज़ marked नहीं है ना, that is actually an extension of 4. All right, that's pretty much what the cardiac cycle is. All these 4 phases. Now, अब मैं सारा वो उसके EKG पे आके देखते हैं. Notice this, the P wave causes atrial depolarization, which causes the atria to contract. क्योंकि ventricles में already filling phase में already almost maximum blood भरता है, तो एक small atrial kick आता है, which causes some amount of blood to enter the ventricles. It's not that significant. उस पर इतना reliant नहीं होता for ventricle filling. Ventricle filling is passive. It's not that valve dependent or any depolarization dependent. Passively भरता है ventricle. Anyway, and then the QRS complex that causes ventricle depolarization. So ventricle contract हो रहा है. That is why your pressure is going up. ठीक है? Now let's go to the T phase. Now T phase is basically ventricular repolarization. Now अब क्योंकि अब relax हो गया आपका ventricle, that's why your pressure is going down up until all these things start happening and stuff like that. Yeah, we can also talk about what EDV and ESV is. EDV is basically end diastolic volume. जो maximum amount of volume जो ventricular इसमें present होता है before the start of systole, diastole. This is the end of diastole. This is known as end diastolic volume. End diastolic volume found in end of diastole. ठीक है? And this is end systolic volume. Why? Because this is जब systole खत्म होता है and diastole starts, this is the amount of blood that's present. So सारा इसने eject कर दिया है, ventricles में सारा blood वो eject हो गया mostly, and at the end of systole, this is the amount of blood that's present. ठीक है? The difference between EDV and ESV is known as stroke volume. तो जो ejection phase में जितना blood वो pump होता है in the aorta, that is known as stroke volume. So the amount of blood pumped in during the ejection phase into the aorta is known as stroke volume. Anyway, that's all you need to know about the EKG. And if you guys have any questions, let me know.